told your friend you're not okay? And tell me what's wrong and why you never said you felt that way. And guess you're trying to stay strong and fake a smile until I look away. But I've known you too long, it hurts to watch your blue eyes fade to gray as you fade away.
What the hell is going on with Trump's health? Seriously, I'm not trying to make fun of him, but the man can barely walk. Now, let's hear what the doctor has to say about this.
That right there looks just like the profile of a leg bag for a urinary catheter. Why would he have a urinary catheter? There's a couple of different reasons. I'm a physical therapist with a doctorate in my field and 14 years experience treating geriatric patients just like the president. I've been out sick today, but everything's fine. I went to Walter Reed and got a perfect MRI. It could be just typical incontinence as the result of aging, which is a common thing to see happen where a person loses control of their bowel and bladder, not because of an illness, but simply because of getting older. Another reason to have a leg bag with incontinence is because of a stroke. You've lost the brain's connection to your bowel or bladder. And a third reason could be Alzheimer's and or dementia. Dementia pokes holes in all of the automatic behavior and awareness that's been built into your brain and your body since you were a child. Whenever I'm seeing a patient with dementia, regardless of how severe it is, a lot of times I can tell how far along the dementia process is based on whether or not the patient is aware of when they need to empty their bowel or bladder. So if he's wearing a leg bag, it could be he is simply not aware, or his nervous system is no longer communicating to his brain that his bladder is full and needs to be emptied. No matter the reason, it's a sign of clear physical and or cognitive decline.
Whether it's true or not, some experts don't believe Trump will make it until the end of his term. Don't take my word for it, but that's what experts are saying. From the first clip that I showed you, he does not look stable. This is not a video you would expect of a guy who claimed to just had a perfect medical exam, including the best MRIs the doctors have ever seen. We should all be concerned. There is one other doctor, and I think his name is John Gardner. So Dr. John Gardner said that Trump has a personality disorder. According to that doctor, Trump has narcissism, paranoia, and sadism all together. This is the medical framework that was normally used to understand dictators and tyrants in the past. And Dr. Gardner recognized this in Trump a long time ago. But guess what? That is only the first part. The second part are the signs of what Dr. Gardner said is a clear cognitive decline.
I may have discovered the medication that Donald Trump is getting through an IV on this hand where it always gets bruised about once a month. I'm a physical therapist with a doctorate in my field and 14 years experience treating patients that are geriatric, just like the president. There's a drug called Kisunla that was approved last July to treat Alzheimer's disease. It's a once-a-month IV infusion. But before someone can start treatment with it, a doctor must order magnetic resonance imaging or MRI of the brain if you have not had one recently. I believe over Labor Day, he definitely had imaging. He started treatment with Kisunla, and then 6 weeks later, he had another MRI to see if there was improvement or decline. Now, this drug works by preventing the buildup of what's known as amyloid beta plaques. The amyloid plaque buildup is characteristic of Alzheimer's disease and also the neurofibrillary tangles. These are like physical changes in the structure of the brain that correspond with a loss in cognitive ability. Notice it's used to treat adults with early symptomatic Alzheimer's, which includes mild cognitive impairment or mild dementia stage of disease. So this would make sense that Trump has been able to function well enough to maintain his office up to this point. Now we're starting to see symptoms arise because the disease is progressing. So he's getting a once-a-month treatment with Kisunla to slow the progression of the Alzheimer's or the amyloid plaques and neurofibrillary tangles to keep his symptoms at bay. That's why this bruising shows up roughly once a month.
I mean to say this in the most serious way possible. There is something seriously wrong going on with him. Now, I'm not trying to make fun of him. Not at all. I think there's a serious medical cover-up taking place. He claimed that he got an MRI after he was basically cross-examined over and over again. Now he says he doesn't know what part of his body he was done on. I mean, if you or I went to the doctor and we got an MRI, we will know exactly what part of our body it was done on, right? I read an article in the New York Times talking about how Trump starts his days at 12:08 p.m. That is basically in the afternoon. Think about it for a moment, okay? The President of the United States starts his day at noon and ends his days at 5 in the afternoon. That's only 5 hours of work. At least in his first term, he started at 10:31 a.m. That is not great for the President of the United States. That is not great at all.
The President underwent a comprehensive examination, including diagnostic vascular studies. Bilateral lower extremity venous Doppler ultrasounds were performed and revealed chronic venous insufficiency.
I'd like to also point out, does this look like mild swelling to you? That's definitely at least moderate to possibly severe swelling compared to what his legs normally look like. I'd like to mention, did you hear the word chronic? Something that is chronic will progressively get worse over time. In my opinion, that I see patients like this all the time. When they come into the hospital, they get a vascular surgery consult to where they have to have a procedure to open up blood flow to the lower extremity because either they're not getting proper blood flow or blood flow has been completely cut off. If that doesn't work, the procedure, then down the road, you could possibly have an extremity amputated. So that is also a possibility. Another possibility with this condition is vascular ulcers. Vascular ulcers are sores to where the skin breaks open on the legs, and that can lead to infection. And then we have patients come into the hospital who end up on IV antibiotics. If it's not caught soon enough, can lead to sepsis. So that is also another issue with this condition. But when you have this condition, you are not supposed to be standing or sitting for long periods of time. And we know with the type of position that he has, that he is sitting or standing a lot to where he can't have his legs elevated to where he can reduce that swelling and have proper blood flow going through his extremities. And again, it's definitely at some point could progressively get worse. So we'll just have to see as time goes.
Now, going back to what Dr. John Gardner said, he pointed out that Trump is giving cognitive tests and MRIs on a regular basis. But here is the sad part. Trump doesn't really know why he's getting them. But Dr. Gardner explains that as a doctor, you never order those tests and these exams unless you suspect something is very wrong with the patient. Now, a personal story. I do my regular medical exam once a year. My doctor never gave me a cognitive test. You just don't give a random cognitive test to a patient unless you suspect something is wrong with the patient. Also, as you guys know, Trump's vocabulary is very limited and is also drastically diminishing. He always forms unfinished and disconnected sentences, jumping from one topic to another. He mixes up names, country, places, and events. He even claimed to have ended a war that never started between two countries. That's how messed up he is.
The president has congestive heart failure, I'm pretty sure. I'm a home health physical therapist with a doctorate in my field. I work with congestive heart failure patients every single day, multiple heart failure patients every day. The thing that tipped me off is the shape of his legs. You can have some fluid retention from chronic venous insufficiency, but his ankles and feet look like he hasn't been able to see the bones in his feet or the veins on the top of his feet for quite a long time. It's already been publicly shared that he takes medication for cholesterol, for a skin condition or rash or maybe something like that. But I'm willing to bet he's also taking a diuretic and probably another medication to help his heart beat more efficiently, amiodarone, carvedilol, something like that. But that guy has congestive heart failure. Or it could be some combination of congestive heart failure and kidney failure. Both of those things can cause your legs to swell like that. I've had many patients who had really significant swelling in their feet and ankles like that, and they go to the hospital with kidney failure, acute kidney failure. Then they get placed on dialysis, either permanently or temporarily, and the swelling goes down dramatically. Of course, this administration is not going to announce that publicly because it would make him look weak and give the public a reason to try and push him out of office or for Congress to impeach him or what have you. It's just perfectly on brand for him to have a serious health condition and act like he doesn't. Oh, and for any of you smooth-brained MAGA voters who want to jump in my comments, just know Joe Biden was not fit physically or cognitively to be president for about probably 2 years. Listen, the people in elected office in America are too goddamn old. They're too old. I'm sorry. They're too old. We need term limits and we need age limits.
Trump has memory gaps and is very impulsive. I mean, have you seen his tweets? He is very unstable. Now, to be honest with you, at first it was kind of funny, but now it's embarrassing and very disturbing. Dr. Gardner also said that Trump shows symptoms of someone who has brain disorder, dementia, and cognitive decline. Now, according to Dr. Gardner, it is not normal aging. He is also warning us that as Trump becomes more impaired, power will shift to people around him. Basically, Trump will not be the person making decisions. Oh, by the way, that's exactly what happens to Joe Biden, which means Stephen Miller will get more power. That itself is very scary. But don't take my word for it. It's just my opinion.